We're in a mental health crisis.
Is it really that bad?
Yeah.
Disease that doesn't discriminate.
It's happening in every zip code. It's happening in every neighborhood.
And now a solution that aims to illuminate.
Our vision is to create a world of well-being for all children.
Children's Mercy, launching a new multi-pronged plan to help kids address mental health. We're hearing from parents.
It's like someone is just ripping my heart out of my body because I know my baby girl is begging for help.
Doctors and the kids themselves.
I think that if I had just had a calmer environment, things probably could have gone a lot smoother.
I met other people who were going through the same thing.
Shining a light into how these initiatives are saving lives.
What this can do will not only transform the healthcare landscape for the children, it will transform the healthcare landscape for our entire community for generations to come.
3 major medical associations collectively declared a national mental health emergency 2 years ago because 15 million children in this country need mental health services. Just at Children's Mercy Hospital, there's been a 67% increase in referrals for kids. But beyond those numbers are kids in our neighborhoods. Kids like Emma Steinman. She's an all-star athlete who's beating her anxiety thanks to a new kind of team.
Any field or court Emma Steinman steps onto, her mom Danielle is always in the stands. After a serious injury and the loss of her grandmother, she was sidelined.
I will just say that therapy and surgery really took the best part of me. Like that, it killed me inside. Like I don't think I've ever cried so much because I wanted to go back to something.
Basketball. And volleyball were her outlets physically and mentally, a way to connect with friends.
It just broke my heart. I wish I would have caught it a lot sooner, but we caught it when we needed to catch it.
My anxiety, I didn't realize how much I had until I developed the day clinic and Miss Ellen as a whole.
The day clinic is the Depression and Anxiety in Youth Clinic. It's a group therapy program created as part of Children's Mercy Hospital's Illuminate campaign.
What are the biggest priorities before it gets started?
One of the biggest priorities we had was the access to care problem. So a lot of families, when they do identify that there's a mental health issue and they look for help, they're surprised to find out that there's not a lot of help that exists, or there's long wait lists to get into these programs. And when someone is suffering with depression or anxiety symptoms now, waiting 6 or more months doesn't often seem like a reasonable option.
Getting a group of teens struggling with their mental health to talk about it together.
I hear that when kids go to the groups, they're often very uncomfortable. Obviously, they have anxiety issues and they don't really love to be there, but by the end, they really learn a lot about themselves. They realize that they're not alone when they're dealing with mental health struggles, and they grow stronger through their work with each other.
They would bring us in. They'd kind of fill us in on what they kind of talked about, what they accomplished within that hour and a half. Also gave us coping tools or strategies, so we would either get a handout or homework for the next weekend and stuff. But they were very open to us asking questions if there was anything.
Just like Emma would work on her jump shot,
as tight as you can while you breathe in.
She was practicing skills to improve her anxiety.
For me, it's still there no matter like what I do, but I've just learned strategies to help myself know that I can do something and put it behind me without it being right in front of my face. You slowly let go.
Our goal is to get kids better faster, get them on their feet and get them back to living their life.
Go. Oh my gosh, you did it!
Emma is back to enjoying what she loves with who she loves, sharing her story so others will open up too.
I definitely want other kids to know that it's okay to ask your parents for help, because I think a lot of parents will miss the signs, but the kids are also really scared to ask. So I just want other kids to know that it's okay to ask for help, because it honestly is the best thing that you could ever do. I just think it was probably one of the best things that you have done, and I honestly really do appreciate it.
I know. I do. I'm very proud of her. I'm very proud of the work she put in. I think she's proud of herself, and that's what I wanted her to get out of it.
Emma is a great kid. The day clinic has a team of 5 featuring psychiatry, a mental health nurse practitioner, psychology, and social work. Emma is a graduate of the first group, and that program, by the way, is open to middle and high school kids from 12 to 17.
Such an important story.